Dr. David Teuscher is the vice president of the American Academy of Orthopedic Surgeons and has closely followed the Affordable Care Act.
When they sold it, they said, well, there's 47 million uninsured out there, and the best I can tell, about 5 million, maybe short of that, have actually bought into coverage, of which 20% haven't paid a premium, so they really haven't bought into that.
He says in order for the act to work, young people need to sign up and pay for health insurance, which isn't happening.
You may see premiums really skyrocket because unless the young, healthy people who don't need insurance start signing up, then you're not going to get people to be able to have the risk pool that's big enough to cover the people that are older who are riskier.
And he says those that are signing up aren't paying.
The vast majority are enrolling in the Medicaid, not the private insurance, so that doesn't increase the risk pool because they're not paying into it. They're simply getting onto a government program, which is going to cost the taxpayers more to cover those people in the future. It really is unsustainable.
Dr. Teuscher says the biggest problem doctors are facing is the uncertainty of the bill, and the biggest problem facing patients is rising costs.
We're seeing an awful lot of people who lost their coverage are now having to enroll again so they can maintain some coverage. And unfortunately, it's costing them a lot more money to enroll in a new policy than the one they had before that they thought they could keep.
With the deadline fast approaching, the Department of Health and Human Services says it expects more Americans to sign up. In Beaumont, Huet, KFDM 6 News.